So, hello guys, today we are going to discuss about the pathohistology of kidney or nephron. So, what will be our motive here? So, today our motive will be how to identify the histological slides. So, we will discuss about the histology. So, let's start it without any delay. First is our normal nephron. So, how the normal nephron looks like. Okay, so let's try to draw it. So this is our parietal epithelium of Bowman's capsule. Okay, so now we'll go with this. So let's think about this is our glomerular trough. Okay, this is our glomerular trough. Now we will see. So let's think about this is all the capillaries lumen. Okay, these are the capillaries lumen, and we know in between here we'll see some matrix. We will see some extracellular matrix. So what is this? This is our mesengium. Okay, so here we will found our mesengium. So now let's think about this is one nucleus mesengial cells, one nucleus mesengial cells, one nucleus mesengial cells. Okay, and podocyte. So where is this podocyte present, by the way? So get here. So podocytes or the visceral epithelium adhere like this. Okay, like this. So and you will see peripheral nucleus. So in histological slide, when you see this portion, which portion? This portion. Okay, when histological slide, when you see this portion, okay, you will find two nucleuses. One is this where is it? So one is this peripheral nucleus. Okay, so this peripheral nucleus will represent what? Podocyte. Okay, podocyte. And there will be another nucleus in this mesengium. Okay, in this mesengium, this will represent what? Mesengial cells. Okay, now there will be another nucleus where here. So here you will find some nucleuses. So what will this nucleus will represent? This will represent our parietal epithelial cells, which are in squamous in nature. And you already get this one. This is our capillary lumens. So this is what you see, and we cannot forget this space. Okay, this space. So what is this space? This is known as Bowman space or urinary space. Okay, so this is a circular space here present. So this space. Claro. Now this is our how normal nephron, or we should say corpuscles, corpuscles look like in the histology. Now what is the second part? The second part is acute proliferative glomerulonephritis. So how will this acute proliferative glomerulonephritis will look like? Okay, so we will draw the same thing. This is our parietal epithelium. So when we say this nephritis or itis, okay, so when we say glomerulonephritis. So this it is what? Inflammation. Okay. So in inflammation, we will see two particular events. One is inflammation infiltration and inflammation proliferation. Okay, so infiltration. So infiltration of what? So we will see infiltrations of two cells. One is N for a neutrophil and M for a monocyte. Okay, two cells. This is the event. Okay, we will discuss how this goes. And now proliferation. Proliferation of what? So proliferation of those cells which are already present in our glomerulus. So what are those cells we got? So let's try to see here. In this capillary lumen, you will find a nucleus, and which will represent what? Endothelium. Okay, so what we got three cells here, right? Podocyte, mesangial cells, endothelium, and definitely we'll get these cells also here, parietal epithelium, or we can say this visceral epithelium. So we got this three cells. So when we are talking about proliferation, so proliferation of what? So we got these three cells. Between these three cells, some cells will proliferate. And what are those cells? One is endothelium and another one is mesangial cells. So one is endothelium, another one is mesangial cells. Now, this is the basic concept we have to remember before drawing this diagram. And another point, important point, we will have to know that when we are proliferating these cells or we are adding these neutrophils and monocyte, it means that this glomerulus will be what? Hypercellular. Okay, this glomerulus will be what? Hypercellular. So this term is very important. So hypercellular. Okay. So first we will draw the normal what? So we know that here is our glomerular capillaries. Okay, then we know that there were some mesangial matrix, right? So this was what our normal glomerular tuft. Now I will not represent this podocyte, just think that it is present there. Now we have two things. One, we say this neutrophil and monocyte will infiltrate. So from where they will infiltrate? So if we suppose this is our capillary lumen, from this capillary lumen, this neutrophils and leukocyte will come where? Here. So now we can say this is what? Infiltration. So neutrophil and monocyte are present in now where? In glomerula. Okay. Now the second point is proliferation. Proliferation of what? Endothelium and mesangium. So endothelium starts proliferating, means endothelium is now proliferating. Okay, so this is how we will represent endothelium is proliferating. As well as what? Mesangium. So now mesengium also start proliferations. So this is what you will get in a histological slide. So basically how you are going to define it. So you will notice that the most of this space is narrowed. Okay, now in this position you can see this Bowman space, but here you are seeing this is very narrow, right? Here is Bowman space is narrow. Okay, so this is what you are going to see. So, and the important point is when I talk about hypercellular, you know, hypercellular. So when you are going to see this slide, what you will find many blue dots, Why blue dots? Because blue violet is the color of nucleus, and if there is lots of nucleus, we can say it is hypercellular. Okay, so this is how you are going to define the acute proliferative glomerulonephritis.